Good morning, Mr. Hassan. I understand you were referred to me by your primary care doctor regarding some urinary symptoms and discomfort. Can you tell me more about what you've been experiencing?
صباح الخير يا دكتور. منذ فترة أشعر بألم وحرقة عند التبول، ولاحظ الدم في البول، وأيضا أشعر بألم في البطن.
Thank you for sharing that. These symptoms can indicate several possible conditions, including a urinary tract infection or kidney issues. I'll need to conduct a thorough examination to determine the cause. Let's start by examining you. Based on your symptoms and examination findings, I'd like to order some tests to further evaluate your condition. We'll need to do a complete blood count, CBC, to check for signs of infection or inflammation and a urine analysis to assess for any abnormalities.
حسنا يا دكتور. أنا مستعد.
In the meantime, I'll prescribe some medication to help alleviate your pain and treat any potential infection. I'll prescribe ibuprofen for pain relief and a course of antibiotics, ciprofloxacin, to treat the suspected kidney infection.
شكرا لك يا دكتور. كنت أريد أن أعرف ما هو التشخيص الذي عندي ومما أعاني.
You're welcome. Now, regarding your diagnosis, it appears you have a kidney infection, also known as pyelonephritis. It's important to complete the course of antibiotics as prescribed to fully clear the infection. After you finish the antibiotics, we'll schedule a follow-up appointment to assess your progress.
فهمت يا دكتور. شكرا لك.
Remember to take the antibiotics as prescribed, even if you start feeling better before finishing the course. This ensures that we fully eradicate the infection and prevent it from recurring.
فهمت. سأفعل ذلك.
If you experience any worsening of your symptoms or develop new ones while on the antibiotics, please contact our office immediately. We want to ensure you're progressing as expected and address any concerns promptly.
سأفعل، دكتور. شكرا لك على الرعاية.
You're welcome. Before we conclude, I'd like to ask a few more questions to ensure we have a comprehensive understanding of your condition. Have you noticed any fever or chills along with your other symptoms?
نعم يا دكتور. كان لدي حمى خفيفة في بعض الأيام.
Thank you for letting me know. It's important information for our assessment. Now, do you have any questions or concerns about your condition or the medications I've prescribed?
نعم دكتور. هل ستتعارض الأدوية التي وصفتها مع أي أدوية أخرى أتناولها؟
That's a good question. It's always important to inform your healthcare provider about all medications you're taking to avoid potential interactions. In this case, the antibiotics I've prescribed, ciprofloxacin, may interact with certain medications, particularly blood thinners like warfarin. If you're taking any other medications, please let me know so we can ensure there are no adverse interactions.
شكرا للتوضيح دكتور. نعم، أنا أتناول أدوية أخرى للضغط والسكر والبروستاتا.
Thank you for letting me know. There are no interaction with any medication you're taking right now. However, let me provide you with more information about the medications I've prescribed. The first medication I prescribed is ibuprofen. It's a nonsteroidal anti-inflammatory drug, commonly used for pain relief and reducing inflammation. You should take it as directed on the label or as instructed by your pharmacist. Typically, the recommended dose for adults is 200 to 400 milligrams every 4 to 6 hours as needed for pain. The second medication is ciprofloxacin. It's an antibiotic used to treat bacterial infections, including urinary tract infections, UTI, and kidney infections. It's important to take this medication exactly as prescribed and to complete the full course, even if you start feeling better before finishing it. Skipping doses or stopping early could lead to antibiotic resistance, and the infection may not fully clear.
هل هناك آثار جانبية لهذه الأدوية؟
Yes, Mr. Hassan. Both ibuprofen and ciprofloxacin can have potential side effects. Common side effects of ibuprofen include stomach upset, heartburn, and dizziness. If you experience severe stomach pain, black stools, or vomit that looks like coffee grounds, stop taking ibuprofen and seek medical attention immediately. Ciprofloxacin may cause nausea, diarrhea, headache, or dizziness. It's important to stay hydrated while taking this medication. If you experience any severe or persistent side effects, please let me know.
شكرا لك على الشرح يا دكتور.
You're welcome. It's important to be informed about your medications and any potential side effects. If you have any further questions, don't hesitate to ask.
أشكرك دكتور على المعلومات الوافية.
You're welcome. Now, let's talk a little more about your symptoms. Can you describe the intensity of the pain you've been experiencing, particularly in your abdomen?
الألم كان متوسط إلى شديد وكان يزداد عند التبول وينتشر في الجزء السفلي من بطني.
Okay, and can you describe the pain that you're having? Is it shooting, burning, radiating, aching, or dull pain? And is it constant pain?
لا أعلم بالضبط كيف أصفه ولكنه وجع. وهو ألم يأتي متقطعا وليس مستمرا.
Thank you for elaborating. It sounds like the pain is localized to your lower abdomen, which is a common symptom of urinary tract infection. Have you noticed any changes in the frequency or urgency of urination?
نعم، كنت أذهب إلى الحمام بشكل أكثر تكرارا وكان هناك شعور بالضغط الشديد عندما يأتي الشعور بالحاجة للتبول.
These are classic symptoms of a urinary tract infection. The presence of blood in your urine, along with the pain and burning sensation, further supports this diagnosis. We'll confirm it with the tests we discussed earlier.
هل هناك طرق طبيعية يمكننا اتباعها لتخفيف الألم وتحسين الحالة؟
There are some steps you can take at home to help manage your symptoms. Drinking plenty of water can help flush out the bacteria causing the infection. Applying heat to your lower abdomen with a heating pad or warm compress may also provide some relief from the discomfort. Additionally, avoiding caffeine and spicy foods can help reduce irritation to your bladder.
شكرا للنصيحة يا دكتور.
You're welcome. It's important to take care of yourself and follow these recommendations to help manage your symptoms until we can fully address the underlying infection. Before you leave, I'd like to arrange a follow-up appointment for you to check on your progress and discuss the results of your tests. Please wait here for a moment, and the nurse will assist you in scheduling the appointment.
نعم، سوف أنتظر. شكرا دكتور.
Hello, my name is Jenny, and I'm the nurse. We need to schedule a follow-up appointment for you. How does 3 weeks from today sound? We have availability in the afternoon.
نعم، هذا يبدو مناسب.
Great. I'll go ahead and book that for you. Is there a preferred time in the afternoon?
أي وقت بعد الساعة 2 مناسب.
Wonderful. I've scheduled your appointment for 3 weeks from today at 3:30 p.m. Here's your appointment card. If you have any questions or need to reschedule, feel free to give us a call.
شكرا جزيلا لمساعدتك.
You're welcome, have a great day, and we'll see you at your follow-up appointment.